Any questions in between, please let me know. Okay, so this is the first presentation I want to share with you. Can everyone see my slides? My slide is my PowerPoint. Yeah. Okay, thank you. Okay, so we're talking about the nursing unit. It's social and community welfare provision. So you've been given basically two tasks in this module or in this unit. So the first task is start annotations. It's a discussion. Now, please make sure that whenever you have your assignments, there are certain word counts that you need to make sure about. So if there's a word count, if the assignment or the task says that you have to discuss something, it could be anything. It will be around this 2,500 words because you're explaining or you're discussing some issue. So what you have to do is discuss the extent to which social issues, how do they impact, or to what extent do they impact or influence both the health and healthcare service delivery in the contemporary society. So this covers your learning objectives 1 and 3, and it is up to 2,500 words. So you would want to follow a standard essay format. You would want to write it in the form of paragraphs, a line of argument leading to a conclusion. So there'll be obviously 2 or 3 parts. So, and we encourage you to write it in paragraphs, and if you want to give headings or subheadings to your document, that's even better. So this is basically a discussion, 2,500 words. Again, social issues that influence both health and healthcare service delivery in the contemporary society. Your second task for this assignment would be to produce an academic poster or display that outlines key milestones in social and community provision in the UK. This is your learning objective that you covered in LOS 2. So your poster should be accompanied by a table that identifies similarities and differences between the current healthcare provision and earlier healthcare services. Now, this poster can be around 1,000 words. Try to make sure that, try and write up to 1,000 words here. And in the same case here, it should be up to 2,500 words. If you're writing something that's very less, like if you're writing only 1,000 words here for the first objective, I mean, you're not going to discuss enough. So that is why discussions, they usually revolve around 2,500 words. In the same way, if you're just displaying an academic poster, which should be precise, which should not have too much details, like in the form of an essay, you would want to write only up to 1,000 words, which would suffice. So these are some of the learning. Are these too clear to both of you?
Yeah.
Yes. Okay, great. If you have any questions, we'll go through an assignment that's been done already, just to give you an idea of how it is done. So you should be able to, this is how we assess you. So for this unit, you should be able to understand the factors that influence health. So it's the contemporaries in the contemporary society that we were talking about. So you're explaining key issues in the contemporary society that have an impact on health, and you're discussing how these issues affect health and well-being. In the second part, you are understanding the development of social and community welfare provision. Here, you are defining key milestones in the advancement of social and community welfare provision. What are the key milestones? So you will be giving a like you've been taught about the key milestones. We've talked about it earlier. So you'll write them in the form of a table, basically, and compare and contrast current healthcare service provision with the previous healthcare services or the previous healthcare deliveries. And in the third learning outcome, you are understanding the values that adhered to in-service provision. Here you are discussing the core values that underpin social and healthcare service delivery, and you are identifying and discussing the ethics that underpin social healthcare service delivery. We've talked all about this. When we are grading you, what we basically see if you have an understanding of the subject. This is because when you're writing so much, we would then understand, okay, that you have a good depth of knowledge regarding this particular subject. You've applied your knowledge. So whatever has been taught to you, that is reflected in your writing. When you're communicating and presenting your work, it is clear. So we know that whatever the way you're presenting it. Now, sometimes people don't write in the form of paragraphs. Even if you're not adding bullets and or headings or subheadings in your document, uh, even keeping them in the form of paragraphs, if you're keeping your writing in the form of paragraphs, it really helps and it improves the quality of your work. So the reader, whenever they're assessing you, the grader, they have a general understanding of what you are doing and what you're about to explain. So even if they have a glance at your document, it gives a good understanding of what your document or what you're going to talk about. That's about your first and your second tasks. I hope that's clear to everyone who's just joined us. I'll just have a look. Actually, Sandra. Hello, Sandra. Yeah. So I'll stop sharing. Does anyone have any questions regarding this assignment discussion? We'll quickly go through a few more bits. Okay. So I'll share the assignment brief with you. This was just a PowerPoint presentation showing you how you have to do it. This is how it looks like. Sir Raman might have shared this with you. Earlier. So this is how it is done. So this is what you have in your document. So you'll have to write your name here, the tutor's name, the subjects mentioned over here, your due date, your date when you submitted, all of that is done. Here is a declaration saying what you have done during this documentation. So it should all be your work. Please be aware that AI is, if you using AI in any of your documents, I'm not saying that you would be using, but if any use of AI is found, that document is then sent back to the learner to redo it. Any direct quotations taken from other reading and research have been acknowledged, so you'll be referencing your documents. Whatever references you're using, they should be in Harvard style of referencing. If anyone has any issues, please let me know. I'll redirect them to the document that shows you how to reference your document or your assignment. Then you would give your signature here. You would write the word count over here. The tutor signature will be at the end. Always mention what grade you're expecting. So sometimes people, they're working very hard and we're not sure if they want just a pass or a merit or a distinction. So when you write what grade you require, we're then aware of your efforts. It makes us more redirected towards that. Word count, we will check if it's the same or not. This is the internal moderator's work. Later on, this is your assignment brief that has been discussed. So you're discussing the extent to which social issues influence both health and healthcare service delivery in the contemporary society. 2,500 word count. And this is task 2. It's producing an academic poster or displaying at the that outlines key milestones in social and community provision in the UK. So there's a table that you would want to accompany. This is the learning outcome, how we assess them. I've mentioned this to you before. Stopping sharing here. I'll share another. Just a minute. I'm not sure whether you've seen this video or not. I'm just sharing it with you because before you start your assignment, you should be.
Hi, I am Goethe and I am.
You should be able to follow these instructions. So because each institute has their own instructions for assignments, for submissions of assignments. Can everyone see my screen? I hope everyone can see my screen. Yeah, okay, thank you.
Hi, I am Goethe and I am one of the student administrators at UK Versity. Today, I will share some tips with you on the assignment submission guidelines. 1. Read the assignment brief carefully. 2. Make a cover page and draw up table of content. 3. Copy the tasks from the assignment brief as it is into your Word document. 4. Pay emphasis on command verbs as you will need to provide theoretical framework. Examples in some cases. 5. Proofread the assignment prior to submitting it. 6. Mention the grade you want to achieve in the email while submitting the assignment. 7. All assignments are submitted on email to learnerwork@ukversity.co.uk. Thank you.
Okay, I hope that's clear to you all. Just a few tips that I've already shared with you. Now, if there are no questions, we'll quickly go through the previous documents that we've covered so far. Yeah? So, okay, this is again a document that I would want to share with you. This is regarding how you have to submit your assignment. This is a sample assignment that has been shared for your understanding. So I'll quickly share it with you. Okay, this is just, yeah, this is for your guidance to support you on how you have to submit this particular assignment. So now, for instance, if this assignment has said that you are submitting a document that is, you have a 2,500 word document of the essay and your academic poster is around 1,000 words. So this is around 3,500 words. Please make sure that your references are not included in it. So your table and your references will not be included. You're adding the particular details here that have been mentioned. And then your student declaration goes here. Here's your signature. You can just write your name also here. This is the total word count and the tutor assesses them. So again, this is for us to assess you later on. These are the comments that we will be giving you on your assignment. This is again for us to do. Okay, so if we start the first, so that this was, okay, always remember, you have this document, so do not remove this. So that when you have this document with you, your Word in Word format, just start writing on this document instead of having a cover page or anything else. So this is the actual submission format that you have to follow. Next, the assignment brief. So copy and paste the assignment brief as it is given to you. Although it is mentioned elsewhere, but you have to copy and paste it again before writing it down. So you must complete both tasks. So the first one is about social issues influencing both health and health care service delivery in the contemporary society. So an introduction is mentioned over here. As I told you, social issues and health have been mentioned in the contemporary society. They in this document, they mentioned as racism and discrimination, social issues and healthcare service delivery, racism and discrimination. Yeah, so this is the same. And a conclusion, as I said, a conclusion at the end. So when you have headings and subheadings here, it becomes very easy for the assessor to mark you. And your second task, is the first task clear to everyone? This should be around 2,500 words. Yeah. So task 2 is to produce an academic poster or display that outlines key milestones in social and community provision in the UK. So how do you develop this poster? This is basically in this form. So we've talked about these issues very briefly, and this is how you would have to make a table and mention these in this table. So the years go, it's up to you how you make your table, but this is an assignment just to show you, give you an example. So it's an academic poster or display that outlines key milestones in social and community provision in the UK. And your references are over here. This is again, sorry, some of the laws that are mentioned over here, the key milestones. And here, there is a table identifying similarities and differences between current healthcare provision and earlier health services. So earlier health services, so every key feature. So this is universal healthcare. So it's mentioned about the earlier provision, and then the current provision is mentioned over here. We've talked about these in quite depth in our previous learning outcomes. Preventive healthcare is mentioned over here previously and now. Patient-centered care previously and now. Use of technology then and now. Social determinants of health then and now. So you're also labeling this table. You're talking about what this table is about. And your references are over here. Is this clear? So up to 6 references is okay for your assignment. I hope that is clear. Any questions? Does anyone have any questions for me?
For me, I think I'm okay.
Okay, that's fine. I'll just share briefly what we've covered so far.
Excuse me, sorry.
Yeah?
You said 6 references is okay.
Yeah, up to 6 references is okay.
Okay.
Yeah? Because we understand this, obviously, it's not very easy referencing when obviously it's one of your first assignments for some of you. If you have any trouble developing these references, please let us know. We have some links that we can share with you to help you understand how to reference. So, if we go through these, just very, very briefly, I'll talk about these learning outcomes so that we're okay, all of us are at the same page. So I'll stop recording because what else? It's district nursing is there, the child health services there, the community occupation therapies, wheelchair services, and health visiting. Later on, we talked about what examples of social welfare are there in Britain. So we talked about cash benefits, which make around 10% of the GDP. We talked about healthcare, which is basically financed through taxes within the UK. And you have this provision where you don't have to pay except for private care. Education, we talked about children who are below the age of 16. They have free education, some have free meals, and this is a provision again through the government. Public housing is there to to support people who are disadvantaged within the society. There are council houses also available. Most other countries have aging population, which is one of the biggest challenges, and in the same way it is this a big challenge in the UK. The government in the UK is faced with a growing elderly population, so sometimes you have people living beyond the ages of 80 years. The different problems that they face, and this is why sometimes we have a difficulty in tackling with those problems. This was your assignment that we just mentioned. So this is the key milestones in health, community health services policy. So I'm not going through all of these, but you would want to write down these in the form of a table. Okay, this is just a revision to help you redirect you to where we had read about it. Some bits about Sir Roy Griffith's report, Marmot Review about discrimination, health inequalities. The National Health Services have been mentioned over here, and a bit about what exists in health and social care. It is the nation's health, NHS performance and waiting times, health and social care funding, health and social care workforce. Why communities matter? So community is at the heart of healthcare, because most of the illnesses, they lie in the community and very few come to the hospital. Being connected matters. There's some reports that are mentioned over here. You can have a look at them. Building social capital with community-centered approaches. How do we do that? So there's a family of community-centered approaches that are there for strengthening communities, volunteer and peer roles, collaborations and partnerships, access to community resources. Social issues in the contemporary society that have an impact on health. So there's qualities, there's mental health, there's particularly for the UK. There's obesity, there's social isolation, how these Okay, sorry for that. I just started sharing my slides. Okay, I hope you can see my slides. Okay, we mentioned this outcome first, and then we went to the the last learning outcome. This is mentioned as LO3, but it was, this is LO3, but the way we went was that we covered LO3 first, and then we went to LO2. So understanding the values, adhere to in-service provision. So what was meant by provision of care values? We talked about the guiding principles that help to put in the interests of the individual receiving care or support at the center of everything that we do. So we talked about individuality, we talked about independence, privacy, partnership, choice, dignity, respect, and rights. What are the values in care and support? So we talked about these values in detail. So there were 7 principles that guide the NHS. So the NHS provides a comprehensive service available to all. Access to NHS services is based on clinical need, not on an individual's ability to pay. So it's free for all. The NHS aspires to the highest standards of excellence and professionalism. The patient will be at the heart of everything that the NHS does. The NHS works across organizational boundaries. The NHS is committed to providing best value for taxpayers' money. The NHS is accountable to public, communities, and patients that it serves. 6 NHS values were discussed, which were working together for patients, respect and dignity, commitment to quality of care, compassion, improving lives, and everyone counts. So we discussed the core values that underpin social and healthcare service delivery, which were equality. According to the Equality Act, we talked about what is the difference between equity and equality. We talked about what person-centered approaches mean. We talked about respect, partnership, safety. Then we identified and discussed the ethics that underpin social healthcare service delivery. So autonomy was discussed, that people have, if they have autonomy, they can make their own decisions. Beneficence means benefiting the people, and non-maleficence means not, this is avoiding any harm, do not do harm. Justice was mentioned, and confidentiality under the Data Protection Act 2018 was mentioned. Then we discussed about our ethics standards, where again, autonomy was mentioned as respect and dignity, beneficence as best interest to the patients, non-maleficence, do not harm, justice was fair and equitable distribution of resources and treatment, confidentiality was privacy of the individual, accountability is taking responsibility of one's actions. These were the references that were shared with you. I'll stop sharing, and now I'll share my 3rd slide with you. Can everyone see my slides, please? Let me know. Yeah, so this is social and community welfare provision. I hope you can see my slides. So this was understanding the development of social and community welfare provision. So we talked about the beverage report. Remember, if you mention these reports, it will be very well appreciated. So there were 4 important reports that were mentioned in the discussion previously. There was the Griffith report, Lord Darzai review, and the Marmot review, which is very important. We talked about key terminologies. So the welfare state, Britain is a welfare state, but there have been various changes that have been there in place to support the poor. Then you had the Industrial Revolution that came, and in 1833, Earl Grey, Prime Minister, set up a Poor Law Commission to scrutinize the work of the poor law system that had been put in place in Britain. So he had a report that was published in 1834, which had several recommendations to Parliament. So previously in 1598, there was Elizabeth I passed an act, for relief of the poor. With regards to that, there were several other changes made, and there was the Poor Act of 1598, which continued till 1948. These theories in social policy, they underpin welfare provision, and to what extent these theories have influenced the delivery of welfare services and met the demands of a changed and changing society. And poor laws were very much disliked. There was a great deal of development of social services in the 20th century, which included means tests, healthcare, and national insurance, which were designed to support industrialized societies and to support them against social exclusion and poverty. And the majority of industrialized and industrializing countries in the world have been welfare states, which means that they play a central role in provision of welfare. Then we talked about a welfare state. So it's very difficult to be a welfare state because you have to deal with job losses, old age, sickness, and disabilities. The level of welfare services and spending vary from country to country. A number of countries have highly developed welfare systems. Some are still struggling. Then we talked about the right wing. So it was said that it is against public provision of welfare and are for residual welfare. They're seen as individualist on the one hand, and left wing is for public provision of welfare, and residual welfare are seen as collectivist. So the left wing is for public welfare and residual welfare and are seen as collectivist. But it is not straightforward, and it has different other things that are dependent on it. So there are right wingers also, which are individualist instead of collectivist as the left wings. And this is how we've seen the Marxist core beliefs coming in, the conservatism coming into play. So the Marxist core beliefs were that welfare concentrates principally on its relation to exercise of power. So Marxist argues that welfare has been developed through the strength of working class resistance to exploitation, and they further argue that the state can be seen as an instrument of a complex set of systems which reflects the contradictions of the society, or as a ruling capitalist class, or at least a part of it. Conservatism or conservatives, they believe in the importance of social order. This is reflected in a respect for tradition. They're more emphasizing on religion and stressing on the importance of inequalities with regards to class. The liberal individualism. So this believes that the premise that everyone is an individual and that every individual has rights. This is their core value. They do not, they have mistrust on the state, and they also believe that the society is likely to regulate itself if the state interference is removed. Then we talked about the welfare state that stretched further under the First World War, where there was the liberal government's principle that emerged that the state should eliminate the worst causes of poverty and introduced a number of policies. These were health, housing, education, pensions, and unemployment insurance, minimum wage boards, and other measures on a strictly limited scale. So all of these, the remnants of these, we still see today. In 1911, you had the first National Health Insurance Act. We're still working according to that. That was by 1917. You had Lloyd George, who was the prime minister then. He argued that the working class will be expecting a really new world. They will never go back to where they were before the war. In today's society, we have been increasingly aware of many diverse needs. So we have the blind, we have the deaf, we have a lot of disabilities here. You have the principle of national minimum standard of life. It is still in place. It has immensely improved in comparison over the last 90 years. The Beveridge Report, we talked about the Education Act 1944, which provided free secondary education for all children. Family Allowances Act 1945, which provided universal benefits for families with 2 or more children. National Health Service Act 1946, which provided free and universal health care. National Insurance Act 1946, which provided unemployment and sickness benefits. The Children's Act 1946 gave local authorities to set up social work for children. So this Beveridge social insurance proposed a flat rate benefit payments to unemployed, widows, pensioners, and the sick. So this was a fixed amount of individuals with additions made for dependents with no graduation or no change in relation to the past earnings. But it was funded by flat rate contributions from the insured ones. So this was the Beveridge Report. Again, as I said, you can add these reports to your document when you're writing your assignment. Coming towards health, so in 1948, you had the National Health Services that was based on principles. We've talked about those principles earlier. Earlier, what happened that doctors believed that they would treat fewer private patients and the outcome meant they would lose out financially. There was also a strong belief that the NHS would not allow patients to pick their own doctor. However, this was not the to be the case, and 95% of the medical professionals joined the NHS. Before introduction of the NHS, you had family doctors. They were charged for their services. It was not a free service. However, more affluent workers paid into friendly societies as insurance. In some parts of Britain, there was workers who joined together to pay a doctor with a weekly stoppage out of their wages. So this was not free for all as it is now. The NHS resource budget for 2023. So it was to be financed. There have been changes in this. So now care was entirely free at the point of use. There was 2 million put aside to pay for free spectacles, for instance, over the first 9 months of the NHS. That went in 6 weeks. Estimates of the cost of the NHS were soon exceeded, and within 3 years, they had prescription charges and dental charges. Sorry. They were introduced charges of 1 shilling, which was 5 pence, and a flat rate of £1 for dental treatment, which is nothing at all. Over the years, the NHS has gone through several changes with ups and downs. In 1970s, things managed unrest, and there were extremely worsening conditions within the environment. And in 1978 and 79, there were shortages in the winter discontent which took hold. This was not help when the consultants went up in arms over the proposals to reduce amount of private work they undertook. 1970s, we saw the ongoing debate on the best way for the NHS to evolve, so that the GPs had introduced the first charter to encouraging the growth of primary care in the UK. So a new system of distributing resources of the health service was more evenly was also implemented in 1974, few months later to look into the problem. NHS that came into being in 1991, and by 1995, all healthcare was provided by the trusts. What is community care? So it came into being in 1950s and 1960s as a result of political realism and progress in the understanding of mental health and the treatments that are now available. In 1959, we had the Mental Health Act that encouraged the development of community care and abolished the distinction between psychiatric and other hospitals. So this is how psychiatrists were questioned traditional treatments for mental illnesses, which they used to give before. The Mental Health Act 1983, it set out rights of people admitted to mental hospitals. The introduction of legislation was there. Sir Roy Griffith's report, we mentioned this earlier. So this gave an agenda for action that was a forerunner to the Community Care Act of 1990. There was major legislation which set out the basis for community care as we know it today. There was a £510 million in mental health services invested. And there was the then health secretary, who was Frank Dobson, who said that the extra £510 million for NHS mental health services over the following 3 years would add to the £110 million announced for social services of the mentally ill. There was another £700 million that was broken down, with at least £500 million being earmarked within for targeted change in the way services were delivered, and around £120 million will be spent on new and effective drug therapies, and £70 million will go towards training mental health nurses and psychiatrists and other care and clinical staff. Then there was the modernizing mental health services strategy that took place. This was a new strategy that said that asked for more mental health beds, more support within the housing. There was a 24-hour crisis team that was developed. There was a government program that was launched to improve on the quality of mental health care and improve the mental well-being of people in England. There were New Horizons, which was a shared vision of our mental health, which was a comprehensive initiative delivered by 10 national government departments. This was towards working towards a society that values mental well-being as much as physical health, and it outlines the benefits of unlocking the benefits of well-being in terms of physical health, educational attainment, employment, and reduced crime, and in turn reducing the burden of mental illnesses. Here is a timeline. Please mention this timeline within your document from 1948 to 2006. I'm not going through all of these laws. We've discussed this in previously. And this is a comparison and contrasting of current health service provision with earlier health services. So that is it from my side. Any questions? I've given this in detail because I remember my internet wasn't working too well, so that is why I had to complete this this session with you as well in detail. Any questions from anyone? Okay, so now that we have discussed this
Can you please share
assignment
the,
brief with,
excuse me, please, can you
yes,
please share the Ascentis award organization where the names and signature and everything. Can you share it in full, please?
can you email it to GL instead? Because I'm not sure if I have that. She's the one who will be providing it, or
Just
the
share
admin.
it now. You share it now.
Share what? Sorry.
The the one you share for assignment that
Okay.
you have to put our names and